Welcome to episode 2 of Wellness Unscripted, where we talk everything about health, skin, and wellness. So, Doctor, in your episode, I'm not going to be asking you questions. We have taken the questions from the public and we have categorized it according to the age. Okay?
Yeah.
So, the age group is 13 to 18. It's like the teenage.
Yeah.
Okay, so shall we go to the first question?
Yes.
Ready?
Yes.
Ayurvedic ആണോ ഡെർമറ്റോളജിക് സ്കിൻ കെയർ ആണോ നല്ലത്? കാരണം ആയുർവേദിക് കുറച്ച് ലെസ് എഫക്റ്റീവ് ലൈക്ക് സ്ലോ എഫക്റ്റ് ആയിട്ട് തോന്നാറുണ്ട്. അതുകൊണ്ട് ഏതാ ബെറ്റർ?
So, പൊതുവെ like she asked, എല്ലാവർക്കും ഉള്ള ഒരു doubt ആണ് that Ayurvedam takes a longer time compared to the other English medicines. What do you have to say about that?
So it's the question that she asked us whether Ayurveda or dermatology skincare works faster or better. It purely depends on your skin type, your concern, and everything related to that. So if you're a person who has Ayurveda basically focuses on the root cause. So Ayurveda doesn't just tell you one skincare routine. It tells you a lifestyle that you need to follow in order to get good gut health, good skin, good hair, good nail, etc. It's not about a localized solution. So suppose നമുക്കൊരു ആക്നെ വന്നു, ഒരു റാഷ് വന്നു, ആയുർവേദത്തിൽ പറയുന്നത് നിങ്ങൾ ഈ ക്രീം അപ്ലൈ ചെയ്യണം അല്ലെങ്കിൽ നിങ്ങൾ ഈ പ്രോഡക്റ്റ് അപ്ലൈ ചെയ്യണം എന്നല്ല. ആയുർവേദത്തിൽ പറയുന്നത് നിങ്ങൾ ഇങ്ങനെ ഗട്ട് ക്ലെൻസ് ചെയ്യണം, നിങ്ങൾ ഇങ്ങനെ ബ്ലഡ് പ്യൂരിഫിക്കേഷൻ ചെയ്യണം, അതിൻ്റെ കൂടെ നിങ്ങൾക്ക് ഇത് externally apply ചെയ്യാം എന്നുള്ളതാണ്. On the other hand, in cosmetology or aesthetic medicine,
Topical creams,
we have a lot of user-friendly, formula these days. So why not do a gut cleanse and a blood purification? Also use a user-friendly cream or a solution. So definitely that will give you a better solution and a faster solution, and also a more sustainable solution. റാദർ നമ്മളിപ്പോൾ ഒരു കൺസേൺ ഉണ്ടായി അതിന് ടോപ്പിക്കലി മാത്രം അഡ്രസ് ചെയ്ത് കഴിഞ്ഞാൽ നാളെ ആ ടോപ്പിക്കൽ സൊല്യൂഷൻ നിർത്തുമ്പോൾ അത് പിന്നെയും വരാം. ആയുർവേദ വിൽ ഹെൽപ്പ് ഇൻ പ്രിവെന്റിംഗ് ദാറ്റ് ഫോർ യു.
Okay.
ആൻഡ് എസ്തെറ്റിക് മെഡിസിൻ വിൽ ഹെൽപ്പ് ഇൻ മേക്കിംഗ് ദാറ്റ് എ ലിറ്റിൽ ഫാസ്റ്റർ. സോ യാ.
So, with regards to that, when you see a patient, like in the age group of 13 to 18, how do you decide whether you have to give her Ayurveda or go for the English medicine?
So basically, when a patient comes to me, I do a 360-degree assessment of them.
Okay.
Starting from their gut health. So they come in and I ask them what their concern is. എന്താണ് നിങ്ങളുടെ concern? Hair ആണോ, skin ആണോ, എന്താണ്? Whatever it is, I ask them everything, starting from their gut health to their sleep cycle to their body temperature. In some cases, I have also seen this surprise on the patient's face asking, ഈ ഒരു concern എന്തിനാ ഇതൊക്കെ അറിയുന്നത് എന്നുള്ളത്. But then gradually they understand why that was very important. So it is not just ഒരു like sticking a band-aid on a problem. No, it
finding the root cause.
Yes, it is finding the root cause, treating the root cause, and making them understand how to follow it up with their life, so that they get a sustainable solution. So they understand their body better. They'll be able to handle the situation better. It is not that, every time you have this, once this is solved, every time you have this, you come back to me. No. Every time you have this, you will know what to do exactly.
Also, are the treatments really long compared to, the aesthetic medicines?
So, there is no comparison, I would say, as such here. Even in aesthetic medicine, you go for a procedure, it requires multiple sessions. There are procedures that requires multiple sessions. There are procedures that requires maybe one single session. So the sessions would come every 3 weeks or every 2 weeks for 4 or 5 sessions, etc. Right? When you combine an alternative system medicine with it or a functional medicine with it, this basically helps in making this time period of yours worthwhile.
Okay.
So that tomorrow your acne is healed, or your pigmentation is healed, or your melasma has got under control. It won't flare up again easily, provided
basically,
you follow
the repetitive nature stops.
Yeah.
Or at least you get to know what the problem is.
Yeah. You'll be able to deal with it better. You will not be, blindsided that ഈ ക്രീം ജീവിതകാലം ഉപയോഗിച്ചാൽ മാത്രമേ ഈ സംഭവം മാറുള്ളൂ. അങ്ങനല്ല.
Okay.
Yeah.
So we move to the next question.
Yes.
ഫേസ് ടാൻ എനിക്ക് ഭയങ്കര വരാറുണ്ട്. അപ്പോൾ പെട്ടെന്ന് പറ്റും.
So this question is very surprising to me because ഈ ഒരു ഏജിൽ
Yeah, I was just about to. Yeah.
we bombard with so many solutions for tan. ഈ soap use ചെയ്താ പോവും അല്ലെങ്കിൽ ഈ home remedies വെച്ചിട്ട് പോവും and all that, and seeing a child at that age ask about this question again.
The fact that she feels that is a problem.
Yeah.
That I feel is something that we really need to make a change. Yeah. So, when a child or anybody for that matter asks me this question, first thing I tell them is, tan is not a problem. Yes, unprotected sun exposure might be a problem, but getting tanned is not a problem. In fact, it is your body's way of protecting your skin. When you are exposed to sun, when that causes a slight DNA damage, your body produces melanin. That protects your skin, and which is the largest organ of your body. Yeah. So
that is basically the discoloration that you see on the skin.
Yes, that is the discoloration that comes on the skin as tan. So നമ്മളൊരു Indian skin tone നമ്മൾ tan ആവും, ഒരു European skin tone അവർ red ആവും. Indian skin tone is more less sensitive to sun because we have melanin, because we have more protection. So the darker the skin tone, the more protection you have from sun. Yeah, the less sensitive you are to sun, the less prone you are to sunburns. So now, if you are tanned and you have suddenly a event coming up, as I told you, it is not a problem, but you want to even it out, or you want to lighten the tan. Then there are hundreds of solutions these days. Starting from one, you have depigmentation creams, which I'm not talking about whitening creams. I'm talking about depigmentation cream that helps in toning down the melanin in your skin. Then there are oral sunscreens that you can have, which are basically basic antioxidant supplements. So what happens is, again, as I mentioned, when you have sun exposure, this antioxidant supplementation orally prevents DNA damage. That causes less of tanning. And less of pigmentation. So that is a preventive method that you can do. Now you have a coat and you can use medical grade detan packs. So what we do at Radiance is we give them something to quickly detan. We give them a Neo Brighten or an Oxygeneo or something that is very easy on their skin, very peripheral, mildly exfoliative, that helps in detanning their skin. Now
this can be used by this age group also, 13 to 18?
Detan packs can be used by these age groups also.
Okay.
Now if it is someone who is not very keen on doing a treatment or doesn't want to do a in-clinical detan, then we give them at-home detan packs that they can use. And we tell them to stay hydrated and cool their skin down, use thermal mist to calm their skin down. That's all that is enough. Using sunscreen, that's what I said initially itself, stressing about it. That is, tan is not a problem. Unprotected sun exposure is the problem here. So making sure that you're protected when you're under the sun, using very mild sunscreen. Now another question that I get is, does kids really need to use sunscreen? Yes, even kids need to use sunscreen because the UV index or the strength of the UV ray is much more than what it was before, earlier. Yeah.
And also there is a topic of discussion with regards to sunscreen in kids, like the chemical and the mineral.
Yeah.
So which one would you suggest?
I would prefer a mineral sunscreen for kids than a chemical sunscreen. Again, when you say mineral sunscreen or a physical sunscreen, the percentage of zinc oxide and titanium dioxide in it has to be looked into, because most of the time these days, even if they say physical sunscreen, the amount of physical screens or the ingredients in that is less, and it's more of chemicals. So picking the right ingredient is important.
If you have to give her an answer of sunscreen, what would you say?
I would tell her use Heliocare or use Isden.
But these are above our budget. What about a little below, if you have to?
La Shield
Okay.
UV-Do. Don't go for these mainstream. See, there's no harm in going for FMCG brands, but make sure you make an informed decision. So a girl of her age, instead of asking her to pick up her sunscreen, I would rather ask her mother or father to pick up a sunscreen for her. Instead of saying you don't need this for your age, and they end up using something that they get their hands on, especially with platforms and online platforms these days. They have
bombarded with so much of information, products,
and they buy it themselves.
Yeah.
They end up messing up their skin. So it's always better that we provide them the right information, we give them the right care, and first of all tell them that there's no harm in being tanned. This is your age to just enjoy
fun.
Enjoy and
I know
have
a lot
fun.
of kids who don't play in
the
because
sun.
They just,
I know a lot of kids who don't get into the rain, saying that I would catch a cold or mudi kedu onnu povum. But I'm like, come on, that's the spirit. So enjoy your tan, but make sure you take care of your skin. And if you have a tanning concern, use whatever is required at that point, appropriate for your skin.
okay.
So for which I would always say, meet a professional and they can definitely help you.
Okay. All right. So we'll move to the next one.
Yes.
My question is what you eat in your diet correlated with the health of your skin and acne?
So that's a very good question that she asked. How is your diet correlated with your skin or acne? Liver is our detoxifying organ. It detoxifies our blood, excess hormones, any excess waste in our body, etc. So your diet affects your internal organs. Your diet affects your digestion. It can make you acidic. At the same time, it can make your gut health better. So starting from your gut to your health of your liver to your internal organs, that directly shows up on your skin.
Okay.
Which is why these days diet is given so much of importance, which was previously shunned down. മുമ്പ് പറയാ ഇങ്ങനൊരു കുരു വന്നു ഒരു ഇത് വന്നു ഇല്ല ഇത് യൂസ് ചെയ്താൽ മതി. ഭക്ഷണത്തിനെ കുറിച്ചോ നമ്മൾ നേരത്തെ ഉറങ്ങണം എന്നോ ഒന്നും പറയില്ല. പക്ഷെ ഇപ്പം എല്ലാവരും എടുത്തെടുത്ത് പറയുന്ന ഒരു കാര്യമാണ് ഗട്ട് ഹെൽത്തിനെ പറ്റിയും നമ്മൾ കറക്റ്റ് സമയത്തിന് ഉറങ്ങണം എന്ന് പറയുന്നതും നമ്മൾ സർക്കേഡിയൻ റിതം റെസ്പെക്ട് ചെയ്യണം എന്ന് പറയുന്നതും. ദിസ് ഹാസ് ഓൾവേസ് ബീൻ സെഡ് ages ago. And
all the kids have phone and they just go through it throughout the night.
And so I have had patients of ours who eat everything, who sleep very late, and then who come to me with a concern of dark circle at the age of 17, 16. All I tell them is, and they ask me, which eye cream do I need to use? Which eye serum do I need to use? And I'll be like, please go home and sleep. You'll be fine. So it's as simple. Now, when we talk about your diet or your, organ health to your skin health, which is why all of these antioxidants are booming these days, including glutathione, including L-cysteine, lycopene, all of that. What does it do? It cleanses your internal organs. It gives you good liver health. It gives you good, good gut health. It increases the antioxidants in your blood. Thereby, it reflects on your skin. It is not like you take a substance like glutathione and it magically shows up on your skin. No, it's doing that internal work on your organ that shows up on your skin. Similarly, in a week, if you eat well, you cut down on junk, you reduce the amount of spices in your diet, you reduce the amount of sweet, refined sugar to be specific, you have less of, milk and dairy products. And Ayurveda, there is a concept called as viruddhaharam. That is, food that you're not supposed to eat together. So milkshake and all comes in that. Like you're not supposed to mix fruits with milk. So so it's basically that basic lifestyle change makes a major difference on the skin. And once you see that the difference that it shows on your skin, you will know how much you're exploiting your body.
Okay.
So it is of major importance, and that's directly because whatever you put in your body shows up on your
the skin. And also because you mentioned about the glutathione, I was just thinking like kids these days, you get these tablets.
Effervescent
tablets.
Yeah.
And it's very cheap and it's available over the counter.
Yeah.
I know a lot of kids who actually have it at the age of 13 and 14 because they just want the glow.
Yeah.
Do you have anything to say about
They
that?
don't need to have glutathione. They just need to have proper food. See, glutathione is something that is already there in your body. It is an antioxidant. It depletes by around 30 to 40% by the time you are your early 30s or your late 20s if your stress factors are high. It is directly proportional to your daily stresses, oxidative stress that you're exposed to, your lifestyle, all of that. So a 13-year-old child doesn't need to have glutathione.
Yeah.
They just need to have sources that naturally has glutathione in it. Berries.
Beetroot.
You have good fruits. Yes, beetroot, pomegranate. You have, your vegetables, your green leafy vegetables. You have good amount of carbohydrates. Don't go all behind protein. You need protein. You also need your carbs. Yeah. So these are all your brain fuel. And having this is more than enough. And being active, because being active is very important. You work out a day, you get that good glow. Your sweat glands also needs to be active. It's not a bad thing to sweat. So all of that is what I would say is that they need to focus on rather than going for easy hacks. And I feel this whole trend behind going for, supplements rather than food. See, supplements are supplements. They're not supposed to be your mainstream food. Is because everybody wants to bypass things now. Everybody wants the easier route. I have seen people drink the effervescent tablets that has green veggies written on it. So they say, this is my daily dose of greens. No. An effervescent tablet is not going to give you your daily dose of greens. Instead, if you have a green juice, that would do the job for you. At least. Yeah. So these are, I think, the trends that needs to stop, that needs to be given more awareness about.
Okay. Speaking of trends, I think our next question would be something related to the trends itself. So we'll move on to that.
Yeah, let's do it.
Does Korean skincare really work on Indian skin?
Korean skincare. I think it's
Before I answer that, you've used Korean skincare products, right? And
yes, I'm a person who follows, it's very funny because I follow, the skincare routines and, all those kind of things. I religiously follow it. So for me, it is, I don't want to answer anything. I want you to answer it. So I don't know. Somehow I love the formulations of certain creams. It's really good. But I don't know about this layering, about 14-step and 11-step and all that.
Exactly.
That's too much for me. I can't do that much. But certain creams, certain formulations, I feel it really works well on my skin. So
see, Korean skincare is not a bad skincare. Or it is not a bad, they have really good formulations. They have some amazing formulation. But that whole Korean skincare trend of that 10-step routine, 15-step routine, layering.
21-step.
21-step, doing some 10, 15 steps in one treatment on the same day. This is not necessary for our Indian skin. So those people who have been to Korea knows that the climate there is quite dry. It might be, the temperature might be higher, but it is not as humid as we have it here. And because of the same reason, you go there, you layer the products, you feel your skin is fine. You come here, especially in Kerala, നമ്മളുടെ നാട്ടിലെ ക്ലൈമറ്റിൽ you put those
breakouts.
The moment you step out itself, you start to look like a glazed donut, and then it melts, and then it's just too much on your skin. Dust sticks to it. And ഈ റുട്ടീൻ ഫോളോ ചെയ്യുന്നവർ തന്നെ എന്നോട് പറയാറുണ്ട്, എനിക്കിത് എല്ലാം കൂടി ഇടുമ്പം ശ്വാസം മുട്ടുന്ന പോലെ. പിന്നെ എന്തിനാ അത് ചെയ്യുന്നത്? See, skincare routine or self-care routine should not be something that is like a burden. It should be something that you enjoy. You told me that you do use some of the Korean products and you enjoy using them. You really like their formulation. You're supposed to like how you feel that on your skin. So if you have an extremely dry skin, and you want to go for 10-step routine and it's working amazingly well for you, go ahead.
Yeah.
I support you. But if you have a normal skin, you have an oily skin, the age group that we are talking about, they definitely don't need a 10-step routine. Even if they have to use any Korean product, I would say just go with a good sunscreen or just go with a good moisturizer. To the limit that they might not even need a toner.
Yeah. Oh, yeah.
So they can just stick to a basic cleanser, moisturizer and a sunscreen. Adu madi. That's more than enough. Adum thanne, if you have a sports day happening, you're out and about in the sun, you have oily skin, you can skip your moisturizer. You have a good moisturizing sunscreen. That's enough.
Sunscreen also comes in matte and all those kind of things. Yeah.
So there are gel-based, matte, there is thermal mist. Now there is this foam-based sunscreens, which is not FDA approved yet. So there are like so many formulation out in the market. So see, and I'm pretty sure the doctors these days and the professionals these days are quite understanding that you go to a doctor and you tell them that, doctor, I would like to purchase this product. Do you think it suits my skin? They will guide you through. They have to guide you through. It's not like you come to my clinic and I'm telling you, you have to use only this product that is there in the clinic.
Yeah.
No, it doesn't have to be that way. So when you have so much of information out there, when you have skin clinics in each and every corner, use that opportunity to make an informed decision. To, instead of blindly following trends. But at one point it was snail.
Yeah.
Now it is salmon.
Yeah.
Tomorrow I don't know what shellfish it's going to be. So I'm not saying it's bad, but it's not for everybody.
Yeah.
And are you that person?
And especially for that age group,
Yeah.
I mean, you really don't need a lot of
You
things,
don't need
yeah.
that. So it's more like നമ്മൾ പണ്ടൊക്കെ നമ്മളെ ചേച്ചിമാർ എന്ത് ചെയ്യുന്നു ചേട്ടന്മാർ എന്ത് ചെയ്യുന്നു അത് നോക്കി ചെയ്യാന്നുള്ളൊരു ആ ഒരു
Panda, there was only one cream and a powder.
yeah. And
Actually, yeah, that was the only
and
thing.
it was much simpler times. Maximum there would be a kajal and a labello.
Yeah, I know.
Yeah.
Labello.
Ippo there is lip sleep mask, there is lip balm. See, all of that is good. Because the എത്രത്തോളം products വരുന്നു എത്രത്തോളം brands വരുന്നു, every brand will want to make their formulation the best. പക്ഷേ on the other side, consumer should not over-consume it.
I think everybody's overwhelmed with so many options and, either product and is like,
is a confusion. So that's what I'm saying.
Every celebrity has their own line of products coming every single day.
And everybody is white labeling products. Ore formulation thanne 4-5 പേരിൽ ഇറങ്ങുന്നു. All of this is happening in the market. So what I'm saying is, if you feel overwhelmed or if you're a person who really wants to start, doing something for your skin, go meet a professional and do it. And I respect the parents who do that, okay? Parayumbo, we have to say that also. That is, there are a lot of parents these days who bring their kids who are of the age of 12, 13 or 14 or 15 and ask us that, doctor, he or she wants to start a skincare routine. What do you think she should start with so that she doesn't or he doesn't blindly follow anything online? Could you please give them a guidance? And that is very good. They're making their kids' life easier. Yeah. So I think that is what is important.
Yeah, being very informed.
Yeah.
Coming to the next question. So, in this age group, what's the kind of skincare routine that you would ask the kids to follow?
So skincare routine for them, I would say just make sure that you cleanse your skin well. Like you come back from school, before you go to school, wash your face, your hands, legs, keep it neat, keep it clean. As soon as you come back from school or, wherever as you return home, make sure that you don't sit around until the sweat sweeps in. Just make sure you wash your face, hands, legs, change your clothes. Follow a basic hygiene. Secondly, have a good face cleanser. Depending on your skin, or a basic gentle cleanser would do, and a good moisturizer. That could be a face and a body moisturizer. You don't have to have both
Yeah,
separately. You can have a face and a body, very light moisturizer, and the sunscreen in handy whenever you have severe sun exposure. And don't start obsessing over
Is
it.
this the routine for all the skin types, like with
See,
acne and?
Any skin type should have a cleanser and a moisturizer and a sunscreen. If it's an oily skin type, go for a gel based. If it's a dry skin type, go for a cream based. Now, if you have a concern like acne and so, in certain situation, we give them a particular moisturizer that suits their situation, or we might even ask them to stop using a moisturizer for some time and give them maybe a serum or a solution or a anything that. So that's completely
Based on
that individual. But it doesn't have to be more than this. And making sure you eat well, making sure that you have your good amount of multivitamin, minerals, everything from your food. Be very active,
and sleep on time.
Yeah, and sleep on time. This is the age where you can go to a football court and not even know how to play football and play it.
Yeah.
So enjoy that, naiveness is what I would tell them to do. Yeah.
Okay. And also we spoke about the skin. What about the hair? I think a lot of kids are going through this hair fall.
Yeah.
I see a lot of kids talking about they have hair fall and all those things. So what would you have to say about a basic, hair care routine? What would?
See, there are a lot of people of their opinion that you should not wash your hair daily.
Yeah.
പക്ഷെ in the climate that we are living in, കേരള പോലത്തെ ഹ്യൂമിഡ് ആയിട്ടുള്ള ഈ ചെറിയ പ്രായത്തിലുള്ള ആക്റ്റീവ് ആയിട്ടുള്ള കുട്ടികൾക്ക് I would say wash your hair every day. So they come and ask me, ഇല്ല ഡോക്ടർ ഞാൻ ഇങ്ങനെ കണ്ടു, അല്ലെങ്കിൽ ഞാൻ ഈ സലൂണിൽ പോയപ്പോൾ ഉള്ള മുടി കളയണ്ട, അല്ലെങ്കിൽ ഞാൻ ഈ സലൂണിൽ പോയപ്പോൾ അവർ പറഞ്ഞു ഡെയിലി വാഷ് ചെയ്യരുത്, ഇറ്റ് വിൽ സ്ട്രിപ്പ് ഓഫ് ദ ഓയിൽസ് ഫ്രം യുവർ hair and all of that. So make sure you wash your scalp, keep it clean, keep your scalp clean. If it is a girl or a boy who has long hair, always make sure that when you're active, you tie it up. You don't let it frizz up and, things like that. Now, use a good, mild shampoo. You don't have to spend 4,000, 5,000 rupees on a shampoo. You can use a very basic shampoo. Make sure you oil if you don't have a scalp acne or, anything of that sort, and you have a normal scalp. Oil at least once a week. It's good. These things were there in our routine for a reason. Yeah. And making sure that if you're feeling tired and if you're feeling a little low on energy, communicating it with your parents and making sure that you don't have any deficiencies.
Yeah.
That is
Vitamin
the most.
D is something these kids.
Yeah.
My
even
son
though
has it, so
that's what. Even though they have sun exposure and all.
Yeah.
The absorption capacity of vitamin D in the body has come down a lot. That could be because of our, food habits, our lifestyle, and the amount of blue light exposure that we have and all of that. So making sure that they get, so that your son has vitamin D deficiency, which is a good thing. So you have found that out, right? So making sure
he's
that
a boy who is always on the field playing football and all that. But
so making sure that you give him the right dose of vitamin D. Making sure that they are dewormed at least once a year or once in 6 months. And so these are the things that should be looked into. That basic health and hygiene, and then along the side looking into the skincare routine is good.
Also for the hair, my son has dandruff. Okay, so the only thing that actually worked for him is he usually washes his hair every day and then he goes to sleep with that wet hair. So what the doctor told was just blow dry it. Just dry it out a little bit so that at least, it's not wet as such when you go to sleep. So is that a hack which helps a lot of people?
See, what if a particular thing is wet, forget hair, even if your cloth is wet, keep it in a corner in this humid climate. What happens? It'll lead to fungal overgrowth there. Then it is a breeding ground for fungus, bacteria, etc. So making sure that after you wash your hair, you let it, if you have the time to air dry it and
Well and
sit
good,
through, well and good. If not, just use a blow dryer in cold setting. I tell this to a lot of our patients that if you are a person who washes your hair in the morning, don't run off by tying your hair.
Yeah.
Just let it dry out.
Right.
If not, you come back home, take your time, wash it, and then dry it. Because that is very important for your scalp. And suppose if you are a person, now see, dandruff is a very colloquial, very common term. There could be fungal involvement. It could be a seborrheic dermatitis. It could be a dry scalp. So identifying what your situation is and then dealing with it is the right way. So if it is a dry scalp, that is because of the lack of moisture or the lack of oil in their scalp. If it is fungal acne, then you shouldn't, fungal, scalp dandruff and fungal scalp acne, then you shouldn't be using oil there. So identifying that problem and then coming up with the solution will help in, finding a sustainable solution. Just like you mentioned, that helped your son. So that is an informed decision he made. Yeah.
Also about oiling, because you mentioned it just came to my mind. Some kids don't oil their hair because they think that's why they get the forehead acne. Is that true?
I have a lot of my patients who don't oil and still have forehead acne.
Okay.
So it's not because of the oil, it's because either you don't wash off the oil properly or your scalp is not clean.
Okay.
So making sure your scalp is kept clean, and even if you apply the oil, I always tell them you wash it off from the hairline. You wash it off from the hairline and you wash soon after washing that off, you wash your body with a body wash and your face with a face wash. So there's no amount of oil remaining. And making sure that you go out, after you go out to play and come back, you wash off your face properly. If you have sweat in your scalp, you wash your hair or take a bath. Letting that sit there, especially if they have long hair, that just irritates your forehead skin. So that is not just for kids, even for adults that happen. Like if we don't wash our scalp for a couple of days, so that is something that can be taken care by just following a routine. Also, taking shower daily helps in bringing down regulating your body heat. That also shows up on your forehead. Like suppose if your body heat is quite high, you tend to see acne on your back, you tend to see body acne and things like that. Or whatever acne you have in your body, if your body heat is high, it tends to purge out. Which is why when you have a fever and you recover, you tend to get a couple of breakouts here and there. So this basically helps in calming down your body in general.
Okay.
Which is why it is a part of your daily ritual.
All right. Yeah. So we've covered hair, we've covered health, we've covered skin.
Yeah.
So I hope we've covered like most of the doubts that the public had.
Yeah.
And the kids have got enough information from us. Yeah.
I hope so. And whatever more information they require, they can always, go meet professionals and get more clarity on that before they come to a conclusion.